We were just talking about transparency in healthcare and how it's like no other animal. I mean, nowhere do we go, whether it be a hotel or the grocery store, do we go in and not know what something's going to be before buying it. So tell us how AMPS is different, and tell us a little bit about a history of transparency in healthcare or non-transparency in healthcare. You go.
Yeah, I think, first of all, it's great to be here, and I appreciate the opportunity. So AMPS, we're all about changing healthcare by paying the right price for the right services at the right time by the best quality provider. And it's amazing. And following up on what y'all said is, nobody knows how much things cost. You can go across the street from one hospital to the other for the exact same procedure, and the variation in pricing is ridiculous. The other thing is the variation in quality is ridiculous. And I use, the food chains like McDonald's, where it doesn't matter if you're in Paris or Boise, Idaho, a quarter pounder tastes like a quarter pounder.
Yep.
It's the same exact product, the same price. And yet with healthcare, the things that are even more important to us than food, right? You can have two physicians who graduated from the same medical school at the same class, even did their residency at the same location, and the way they perform the procedure and how much they charge for it is completely different. So what AMPS does is we reprice a claim based on Medicare, right? The government has already told us what they think the fair price is for services based on a Medicare allowable. And so what AMPS does is we take that claim in, that bill or invoice in from a member, and we reprice it and pay the provider based on a Medicare allowable versus what their bill charges are. And we see tremendous variation. In the state of Texas, as an average, 868% of Medicare is what the average hospital bills at. 868%. And within that 868%, you have some that are billing at 4,000% of Medicare and others that are billing at, 250% of Medicare. The point being, the variation is incredible. And the results for the same procedures across the spectrum of healthcare are also incredible.